President Biden has laid out his most forceful pandemic action yet. His order on Thursday calls for sweeping federal vaccine requirements for as many as 100 million Americans. All businesses with 100 or more workers will need to either mandate vaccines or administer weekly tests for employees. So that means that the nearly 1 million Americans who work at Amazon in the U.S., the 1.6 million who work at Walmart, have to be vaccinated or get tested each week. If employers don't comply, companies could receive fines of up to $14,000 per violation. It's an all-out effort to curb the fast-spreading Delta variant and comes with sharp criticism from Biden.
This is not about freedom or personal choice. It's about protecting yourself and those around you, the people you work with, the people you care about, the people you love.
Joining me now to discuss is Bloomberg's Emily Wilkins down in Washington, D.C., also Associate Professor of Epidemiology at the Johns Hopkins Bloomberg School of Public Health, Professor Carrie Altoff. Emily, I want to start with you. How does Biden plan to actually pull this off?
So the Department of Labor has OSHA, and OSHA, which is already responsible for safety requirements and precautions in a number of workplaces, is now expected to implement this. But let's be real, there are some big questions here about exactly how they're going to do that, how they're going to track whether workers have a vaccine, if they're getting tested. There are a lot of questions out here about how this is going to work. Never mind the big legal question, which is, can President Biden actually do this? I mean, yes, OSHA is there to enforce safety laws, but the key word there is laws, things that usually Congress has come up with and developed. And at this point, Congress hasn't had something like this. It's very interesting when you look at what the president has put out there. It's very clear that, he sat down, spoke with his lawyers, tried to figure out exactly what the mandates they might be able to do that could be within the legal realm. Obviously, federal employees, federal contractors, employees at hospitals receiving Medicare and Medicaid. But it'll be very interesting to see how it plays out with these companies of 100 or more workers who are now going to have these new standards to follow.
Well, setting aside the legal questions and whether or not this is something the president can actually do, Professor Altoff, I'm wondering from the epidemiological perspective, as an epidemiologist, is this the right move? Is this the right way to get the United States past the pandemic?
Well, without a doubt, the vaccine itself and vaccination, shots in arms, that's how we get a handle on this virus again. And as we saw with Delta changing the game, we know there are other variants waiting in the door. So we need to really stay on top of this. Vaccination, it really is the way to go, but there are still a few holes that we'll see in our society in terms of who is unvaccinated, namely children, as we still await those vaccines. And we really have to help push for that. And as part of the plan that Biden put forth, he did specifically state providing support to the FDA so that that process can move smoothly. That's just not for the kids. It's to protect the kids, but it's also these families, right? Families who have unvaccinated children, they are struggling to try and re-enter the workforce and protect their kids at home, has economic impacts, as well as just, routinely wondering, is today the day I'm going to get quarantined with my child? With school back in session, just a lot of quarantining going on in this country.
Emily, what are your sources telling you about the chances of a plan like this backfiring? What happens if it does backfire? What happens if people who are unvaccinated say, wait a second, I'm not going to get a shot because the government tells me I have to do it? That's a hill I'm willing to fight on.
This is a bit of a risk for President Biden because, yes, there is a very real chance that this winds up backfiring. Obviously, the president's goal here is to get more Americans vaccinated, to get the economy fully back open, and to really get things reopened again and bring back that sense of normality that we don't have, in part due to the Delta variant, and that could potentially continue with coming variants. So Biden's taking a bit of a risk here because you already have started to see blowback from Republican governors. South Dakota Governor Kristi Noem has said that she's going to be taking this to court. You've also heard of potential legal challenges coming from the RNC. So this seems like something that Biden's going to have to be fighting a little bit here, at least in the courts and in the messaging component as well. I mean, the Americans who have dug in their heels at this point and remained unvaccinated, it's not very likely that they're going to be swayed by President Biden's speech alone. And this could have huge political backlash for his mandates here.
Professor Altoff, I'm wondering specifically about the testing versus vaccination, because there is this distinction, I think, between a vaccine which prevents illness and also prevents hospitalization. It's been shown to do that. But testing, which is simply a diagnostic tool. And I'm wondering if the threat of a weekly test is enough to actually prompt people to get vaccinated.
Well, we've already seen this because there are different companies and groups who have moved to this step even before Biden's plan. And we have noticed that, yes, the inconvenience of weekly testing for many adults is just not something they're willing to take on. And so they will get vaccinated and they
So
will
it is
push
that
forward.
So it is that inconvenient.
Well, it depends on how your employer sets it up, right? We're talking about companies that have 100 employees or more. Some of those companies are pretty small. So can they do on-site testing? Probably not. That means that worker is going to have to go seek out testing, file the results. It can be a real hassle for people, especially right now. We all seemed a little bit pushed to our limits. And so some of this is going to be a convenience thing, and it's going to push that group that really needed that final kind of push to get vaccinated right into that spot. But, you know, the other part about this is we're also seeing different groups move even beyond that. Even at my own university, vaccine is now required, and there aren't going to be testing options in the near future. It'll be a condition of employment. And so there are a lot of different groups who are really pushing for this. A lot of the big companies that are also coming out today and saying, we're glad to see this. We're happy to put these measures in place. That is really to help protect not only their workforce, but also the clientele of Walmart, of Tyson
Right.
Foods, all of these large scale companies. I think the one thing that might be missing from this plan, however, there are a lot of people who do have real concerns about the vaccine, and they need more than broad scale messaging. It's very interesting that we do not currently have set up a nationwide one-on-one access to an expert who can talk you through your specific concerns. And doing quite a bit of vaccine hesitancy counseling right now. Those questions and concerns that people have, they're very real, but most of them can be addressed with a trusted conversation. It's just, again, a situation of resources. Public health and medical professionals are kind of pushed to the brink right now. So working to fill that gap, how do we have these conversations one-on-one with people who need them to help get them moving towards vaccination?
This is a story that is a public health story, but it's also one that's inextricably bound to the economy, and it's an economic story. And we